Hi, this is Dr. Doug Kennedy. I'm back with you to talk a little bit about some of the most common symptoms following whiplash. This is a quick video talking about the symptoms that people experience, as well as where do these symptoms come from and how serious are they. This is something you need to be able to determine as to whether or not you're going to go get help or you're just going to wait it out a little bit and take some over-the-counter medicine. So let's get started right away. Here you can see common symptoms following whiplash. This is data compiled by the Spine Research Institute, and essentially, out of thousands of people that get whiplash with rear-end accidents, most commonly neck pain is number one. Now, the next most common, tied with fatigue, is headache, 57 and 56%, and then shoulder pain, anxiety, pain between the shoulder blades, low back pain, sleep disturbance, upper limb paresthesia, which means numbness, sensitivity to noise, and the rest of this shows concentration can be affected. You might have blurred vision. Now this is blurry, so don't be alarmed. Irritability is another one, dysphasia or difficulty in swallowing. Sometimes there's a little swelling in your neck, and if you have swelling, you may have a hard time swallowing, almost like you've got something caught in your throat. If this doesn't go away quickly, then you need to have it checked out because there may be a bleed closer to the spine, a little bit of blood that's stuck in there. Dizziness, forgetfulness, upper limb pain, upper limb weakness, much more severe when this happens. If you start having difficulty holding things, if you're holding a cup of coffee and all of a sudden you're just dropping it, this is not something to wait out. You definitely want to go seek out medical care right away. So let's look at what some of these symptoms might look like. Here's a referred pain pattern, also from Dr. Art Croft's poster board. And basically what I want you to notice here is that these are the areas of the spine, starting at the top, working its way down to T2, which is just below your shoulder blades, just at the top of your shoulder blades, the base of your neck. Look at, if you have an injury down low here, low in your neck, these lower vertebrae, look how it can refer pain to the front of your chest. Now this is not a shoulder belt injury, this is pain coming from your neck. This area over here is quite interesting because many people will complain of this dull, achy pain between their shoulder blades or along the top of the shoulder blades, and they want to rub it, massage it, put Bengay, whatever, and it doesn't seem to go away. That's because this pain is coming from the neck, and let's look at where it might be coming from in the neck. So this is a picture of two vertebrae in the spine and the disc in the middle that is essentially meant to be a shock absorber and a spacer. Now the integrity of the spine is held together. It's a bit like a ship's mast. There's that one pole going up the mast, but then there's all those little wires. And what holds our spine together and allows it to be very flexible yet strong is that we have these rigid parts, which are the bone, and then we have quite a bit of tension structures. So these, this blue area here in the back, this blue area in the front, these are tension structures, and they're designed to basically help hold everything together. So if you've had a bad accident and you've had either some disc disruption or some tearing in the ligament here, you're certainly going to have a sloppy joint in your neck, and you should have quite a bit of pain. This area back here on the back side might not be quite as painful as long as you're not moving your neck, but as soon as you try to tuck your chin, you're going to feel some kind of weird, sharp, achy pain back there as well. Now, just keep in mind that those structures in the spine are deep, and they can cause these weird referral patterns. They're not linear, they're more like blobs or big long swaths, and they don't go away when you rub them. So if you can't quite put your finger on where the pain's coming from, and it doesn't get better with just rubbing it or heat or ice, then it's probably not a pulled muscle, it's probably coming from the spine. Quick simple test, you want to try it out, as long as this doesn't hurt, and I obviously don't want you doing something at home that might hurt yourself. I want you to just turn your head to one side, look up and back slowly, and notice if you get your ear going back over the back side, if you don't feel some sort of swath or dull achy pain go down in the back. Now when your head is back like this, the muscles in the back are not being tight. So you're not getting tension in the back here by looking up and back. If you look up and back to the right on this diagram here, you will see this blue pattern might come from C6 or C7. The muscles at C6 and 7 are not being stretched right here. If anything, the capsule, the spine is being compressed, causing this pain. So this is a referred pain, meaning it occurs in one place and it refers out to somewhere else. Like a doorbell, you can press here and you might feel a pain somewhere else. That's a referral type pain. Now, let's look at another type of pain, and this is more dermatomal. This is where the nerve itself, I'll show you what that structure looks like. Here's a section of the spine, and these yellow things are the nerves. Here's a healthy nerve. This white in the middle is your spinal cord. So it's coming up and out of the screen, and basically if you were to chop my head off and look from the top down, this is what you would see. And we've got spinal cord. Over on this side here in red, you'll see there's a posterior lateral disc herniation. This just means the disc is pushing out to the back and to the side. It could push right against the nerve and give you pain. It can give you what's called radiculopathy, or more of a linear pain. The radical nerve root is from the Latin meaning root. This will be more of this type of pain. So if you've got a C4 type pain, it's going to be this yellow band. And let's take something a little lower, like C7, this light blue band will come down the back of your arm. It's very linear. It's not going to look like the C7 pattern that we saw over here, which is this color here that's a little blobby and skips and moves around, okay? So here's C7 can be here, it can be here, it can be down here, it's blobby. This part overlaps with the C7 that we're seeing in this picture, right here, all right? But dermatomes tend to be linear, and they tend to be associated with nerve irritation. They feel nervy, they kind of burn, and it's not a dull ache, it's more of a sharp type of pain. And maybe you lose sensation where you can't quite feel a cotton tip or the backside of a pen on your finger. If you're having any of these things where your fingers feel puffy or like little sausage fingers, or one or two of the fingers are not working right, or they feel numb, this is probably a radicular or dermatomal problem, and would definitely require medical care. Okay, so the take home here is that there are quite a few symptoms. The most common ones are on this slide, and if you're having any of these and they don't go away right away, I'd strongly recommend that you see a chiropractor or an osteopath or a medical doctor that specializes in whiplash. Don't go to just any person. Look around, find an expert in your area that has trained in whiplash, because the last thing you want to do is just see somebody that's going to say, well, if it hurts, I'm really good at massage, I'm going to just dig in your neck and we'll get that fixed. Well, if they go digging in this area and they irritate the nerve root even more, which can be done quite easily in this part of the neck, you may have a sore arm for days and days, and they might do damage. So look for an expert. You want to look for somebody that's done their homework, that treats this all the time and is gentle and willing to send you out to get some imaging, x-rays, MRI, CT scan, that sort of thing. Okay, so that's it for now. Thanks for joining me. This is basically entitled Common Symptoms of Whiplash. It's meant to give you an idea of where the symptoms come from, how severe they might be, what are the common ones, and essentially I will see you in the next video. In that video, we're going to talk about how you can know whether or not you need to go in right away or not. Okay? So I'll see you on the other side.